All right, so ultimately coming down to is my ultimate quest, I would say, was looking at 3 areas that we practice under: think well, eat well, move well, as concentric circles, and each one of those, as they are more aligned, this result center gets a lot thicker. So in other words, if when I came on board, I felt like the move well portion was way over here, okay? I felt like the think well was kind of right there, it was kind of cool, and the eat well was okay. But I think for the most part, I felt like these circles were kind of separate, you know, whether it was in the languaging barrier between the trainers and the doctors, or just the philosophy between the two weren't aligned. And I think that alone caused a little distortion in the patient's brain a little bit, because obviously they pick up on that, guys, because, you know, one thing I always talk about with my kids is it comes down to consistency, congruency, confidence, and then ultimately they converge and actually know what's going on. But consistency and congruency are huge portions of it, and they weren't quite there. So what I'm feeling from this program is the fact that we create more consistency, more of a language ability of syntaxing between the doctor and the trainer to start talking and say, okay, how's it going with that patient? You know, it's really nice to walk in here now and say, you know, Mary didn't really do well with the overhead pass-throughs. And the trainer kind of has an idea where we're going right away off that get-go. So it's supportive in nature. The chiros now have a gap, the trainers now have a gap to implement chiro into their languaging, because of understanding how cross syndromes work, that when the spine is stuck in this DP posture all day long, no amount of shoulder pass-throughs are going to get a person out of this hunched posture. But a nice thoracic mobilization technique, you know, nice anterior adjustment, nice adjustment of the spine, creates that mobility very quickly for the patient. They have almost instantaneous feedback. Your trainer is now encouraging the muscles that are attached to that spinal segment to encourage them to move through that motion, or you'll see in a second, they're releasing the muscles that are involved and stretching them, and then motioning. So when the patient gets done, they're getting joint mob, soft tissue work, and then patterning. So that's kind of the philosophy or feeling behind what we're going to do today. It's going to be, again, mobilize the tissues, not necessarily adjustments. We're going to use some, in here, in a trainer spot, we're going to use a foam roller or a lacrosse ball or some other apparatus, like maybe a snake or a PVC pipe, to show you how to mobilize tissues, to release those breaks, stretch them, and then ultimately it's going to go into stability above and below the area to stabilize those sections. We're primarily going to be in the low back, in most areas for stabilizing, and then also into your patterning. And patterning, guys, is a huge part. The reason why your patient comes off that table and feels better is because gravity and that patient agree better. Their body stands up, gravity goes through their body, their facet joints are released, their motion's restored back into the segments, their body can settle into a nice restraint, just like my daughter when she tripped and fell at 4 years old. They're a little younger every time we get off our table, which is nice. So obviously, you know, the net effect of not moving in the long run is called death, right? We get to a point where we just stop moving. You know, and you guys probably know more than I do, you know, practice for a while. The patients that are coming in that are walking like Frankenstein, you know they're on that lower end of health overall. They're going to score bad on our wellness score right at the get-go because there's no motion or no movement in that person. The eventuality is going to be not a good outcome. All right.